Hello, how are you today?
Good, how are you?
I'm good, thank you for asking. Today we'll be doing an oral mechanism exam, and this is to check how well your mouth and throat work while you're speaking and swallowing. Okay. I'll explain each step as we go, so you're as comfortable as possible. If you have
Okay.
any questions at all during the examination, please don't hesitate to ask. And if you're uncomfortable at all, please tell me.
Okay.
Okay, does that sound good?
Yeah.
Are you ready to start?
Yeah.
Okay. So first, as you can see, we're sitting at eye level. That way we can communicate and I can see the functions of your mouth and your face symmetry and stuff. And also I'll be using these medical gloves to keep things sanitary since I'm working around your mouth and your face, just to keep things clean and to not put any discrepancies during our results in my data that I'm going to be taking throughout. So if I'm taking notes, don't mind, I'm just remembering things since we're going to be doing quite a few things today. I'll be using a small stick called a tongue depressor, which is in here. We keep it sterile. And I'll just be using this to gently hold your tongue down, to move your tongue around just to see your inside of your mouth and to make sure everything's functioning properly. And I'll also be using this for your gag reflex.
Okay.
And I'll also be using a pen light while I'm using the tongue depressor in times just to see the inside of your mouth better, so that I can just have a better look of it to see if everything's working. Sorry. And I'm also going to be using what we call these are long cotton swabs, kind of like when they test for COVID, it goes up your nose, but we're just going to be using it on your cheeks and on the inside of your mouth just to check sensitivity. Okay. Also, while you're just sitting and relaxed, I'll be listening to your breathing to make sure it's normal, nothing's abnormal to be taking note of. I'll also be looking at your posture, your positioning of your mouth and your face, and how you're sitting, and also how your muscles contract when I'm doing the sensitivity tests or the gag reflex, but that's all normal functions of our body. I'll also be looking at your alertness and your responsiveness during this examination, just to make sure you're responding and answering my questions appropriately. Does that sound good?
Yeah.
Okay. It's a lot of information, I know, but I just want to make sure you're comfortable so you can ask questions before we start. And also I'm going to be asking you questions throughout to make sure everything's seeming okay and if there's anything abnormal that you feel. And please let me know if anything doesn't feel right.
Okay.
I'll also be looking at how you manage saliva in your mouth. So if it's coming out of your mouth, I'll be taking no, or if it's normal, that's awesome. Just want to make sure everything's working okay. And I'll also be looking at your timing of swallows while you're resting. If you're needing to swallow multiple times, if you're not needing to swallow, etc. If that makes sense. And also I'll be checking for your breath. I just want you to start. I just want you to hold your breath for a few seconds and then just let it out. Okay, does that seem okay?
Yeah.
That was just to test your breath control to make sure everything's normal. Now I just want you to relax and I just want you to breathe normally, and I'm just going to listen to your breathing. Perfect. And you were breathing through your nose. Very quiet breather. Very quiet breather. We have some breathers that are very loud. Okay, so now I'm just going to look at your lips, tongue, and the roof of your mouth with the light and possibly the tongue depressor if needed, but it's mainly just the light. So I just want you to open your mouth. Oops, sorry, I just shined that in your eyes.
No, you're good.
Good. Can you say "ah" for me? Perfect. Okay, everything's looking good. Okay, now let me write that down. Okay, so now we're going to look at your teeth, or your dentition is what we call it in our expertise. I just want you to smile for me so I can see your teeth. Good. There's no secretions. Good. And there doesn't feel like there's any extra saliva in your mouth at all right now while you're resting?
No.
Okay. I'm just making sure your oral health is good. So, looks great. Next, I'm going to do what we call an oral function exam. And this exam helps me understand your oral motor skills, which are very important, obviously, for speaking, talking, chewing, swallowing. Obviously, we need our mouth to do all those functions, right?
Right.
So first, we're just going to look at your jaw movement. So can you open your jaw for me and close it? Good. And then now can you move your jaw from side to side? Good. And can you protrude or push your tongue or your jaw forward? Sorry. Okay. And pull it back. Good. Okay. That was perfect. And now your jaw movement's great. That's what that test is for, obviously. Now I just want to see your lip function. So can you push out your lips like you're going to kiss? And then pull them back like E. One more time. Good, perfect. Okay. Now I'd like you to smile. And then now I want you to push your lips as tightly as you can together. Perfect. Okay, you're doing great. Now we're going to check your tongue movement to make sure that's working, obviously, because if a tongue doesn't work properly, then we're going to struggle with swallowing, right?
Mm-hmm.
So I just want to make sure that's all right. Are you doing okay?
Yeah.
Okay. So I just want you to stick your tongue all the way out as far as you can. Good. And pull it back in. Now from one side. Good. The other side. Good. Now I want you to try to touch the corner of your lips, just like this. Good. Good. And then can you put your tongue to your top lip? Perfect. Does that feel okay?
Yeah.
Okay. Now is the time I'm going to be using the tongue depressor, and I'm lightly going to push down on your tongue. And I'm just wanting you to say "ah" for me, and I'm just looking at your soft palate or just the back of your mouth a little bit, okay?
Okay.
Okay, so I'm going to shine this light into your mouth as well while I'm doing it. Are you ready?
Yep.
Okay. Just want you to say "ah." Good. Perfect. Okay. Now, I'm not going to be using the light, but we're going to be testing your gag reflex. I like to warn my patients because it's uncomfortable, and that's normal. But if it's too uncomfortable, just let me know, and I'll stop, okay?
Okay.
Perfect. Okay. Does that feel okay?
Yeah.
All right?
Yeah.
Okay. Just want to make sure because that's obviously a very odd sensation. So now, like I said earlier, we're going to be using these little long cotton swabs. I'm just going to swipe it across your face on both sides, and then I'm going to also do it on the inside just to make sure you can feel that.
Okay.
And in some way, if you can tell me that you felt it or just say yes, that'd be great. Okay?
Okay. Yep. Yep.
Okay.
Mm-hmm. Yep.
Perfect. And did anything feel odd or off?
No.
No? Okay, perfect. You're doing great. Okay, we're just about done. So now I would like you to say "ah" for as long as you can. And this is I'm just testing the quality of your voice. I'm just going to take notes while you're doing it. So don't mind me, but I just want you to say "ah" for as long as you can. Good. That seem okay?
Yeah.
Didn't feel like you were exerting your lungs or you weren't forcing your air out?
No.
You felt pretty relaxed? Good.
Yeah.
Perfect. I'm going to note all these things. Everything seemed normal. I'm just going to make sure everything's good, and I'll score this out. And if there's any recommendations, I'll reach out to you. But
Okay.
Do you have any questions?
No, I don't think so.
Okay, well, thank you for your patience and cooperation, and have a good rest of your day.
All right. Thank you. You too.
Thank you. Almost 7 minutes. Oh, geez, it's still going.